If you've been told that eating eggs daily is harmful for your cholesterol levels, dangerous for your cardiovascular health, or something you should avoid as you get older, I'm about to share research that might completely transform your understanding. Because here's the reality. Eggs are among the most misunderstood and unfairly criticized foods when it comes to men's health. And what the scientific evidence actually reveals about consuming eggs regularly, especially for men over 40, 50, and beyond, is going to surprise you. I'm Dr. Thompson, and today I'm going to explain precisely what happens in your body when you eat eggs every single day, the effects on your testosterone levels, prostate health, cardiovascular system, muscle mass, and overall vitality. And I'm going to share why eggs might represent one of the most powerful whole foods for supporting male health as you age. Before we dive into the science, I want you to understand where this information is coming from. What I'm sharing today isn't dietary opinion or nutritional philosophy. It's based on peer-reviewed scientific research, clinical evidence, and physiological understanding of how specific nutrients affect male health. I have no financial interest in whether you eat eggs or not. I'm simply presenting what the research actually demonstrates about this remarkably nutrient-dense food and its effects on various aspects of male physiology. In my years of clinical practice, I've reviewed extensive research on diet and men's health, and I've observed clinical outcomes in patients who've made strategic dietary changes, including incorporating eggs consistently into their routines. So if you're ready for an evidence-based discussion about what eggs genuinely do for your body, not what outdated dietary guidelines from decades ago claimed, stay with me. If you find this information valuable, I'd appreciate if you'd subscribe to the channel. It helps support the work we're doing. Now, before we discuss what eggs actually do for your body, let me address the myths and misconceptions that have unfairly demonized this food for decades because there's substantial outdated information that needs correcting. Myth number 1. Eating eggs daily will spike your cholesterol and cause heart disease. This is probably the most persistent myth, and it's been thoroughly contradicted by modern research. The dietary cholesterol in eggs has minimal impact on blood cholesterol for the vast majority of people. Your liver produces most of your body's cholesterol, and when you consume more dietary cholesterol, your liver simply reduces its own production to compensate. It's a homeostatic feedback system. Myth number 2. Eggs are harmful for your heart and increase risk of heart attacks or strokes. Multiple large-scale studies involving hundreds of thousands of participants have found no association between moderate egg consumption, even daily intake, and increased cardiovascular disease risk in healthy individuals. In fact, some research suggests eggs may actually support cardiovascular health through multiple mechanisms. Myth number 3. You should only eat egg whites and discard the yolks. This advice is completely backward nutritionally. The yolk contains virtually all the beneficial nutrients, including those that support testosterone production, brain health, and overall vitality. Consuming only whites means you're missing the most nutritionally valuable components of the egg. Myth number 4. Eggs are just protein and don't offer much else nutritionally. Eggs are genuinely one of the most nutrient-dense foods available. They contain high-quality complete protein, healthy fats, vitamins A, D, E, K, B complex vitamins, including B12, choline, selenium, zinc, and numerous other micronutrients essential for male health. Myth number 5. As you age, you should consume fewer eggs. Actually, the opposite may be physiologically true. As you age, your need for high-quality protein increases to maintain muscle mass. Your need for nutrients that support testosterone production, cognitive function, and overall health also increases. Eggs provide precisely what aging men need most. So here's the evidence-based reality. Eggs are not the dietary villain they've been portrayed as. When you examine actual scientific research, not outdated guidelines from the 1970s based on flawed assumptions, eggs emerge as one of the most beneficial whole foods you can consume, particularly for men's health. Today, I'm going to walk you through exactly what happens in your body when you eat eggs daily, backed by legitimate scientific research. Effect 1. Testosterone support. Let's start with something critically important for men: testosterone production. Eggs contain several nutrients directly involved in testosterone synthesis. Cholesterol. Testosterone is biochemically synthesized from cholesterol. While your liver produces most of what you need, dietary cholesterol provides substrate for hormone production. The idea that you should avoid dietary cholesterol for healthy testosterone is biochemically backward. Vitamin D. Egg yolks are among the few natural food sources of vitamin D. Research demonstrates strong associations between vitamin D status and testosterone levels. Vitamin D deficiency is linked to low testosterone, and adequate intake supports healthy levels. Zinc. Eggs provide zinc, which is essential for testosterone production and testicular function. Zinc deficiency is directly correlated with reduced testosterone, healthy fats. Testosterone production requires adequate fat intake. Low-fat diets are consistently associated with lower testosterone levels. Eggs provide exactly the types of healthy fats your endocrine system needs for optimal hormone production. Research published in the Journal of Clinical Endocrinology found that men who consumed adequate dietary cholesterol and fats had significantly higher testosterone levels compared to men following low-fat, low-cholesterol diets. Biologically, eggs provide the nutritional building blocks for testosterone synthesis. Practically, this translates to better energy, mood stability, confidence, and overall vitality. You feel more capable, motivated, and engaged rather than chronically depleted. I had a patient named Robert, 56, whose testosterone had declined to 320 ng/dL, low normal range. He'd been following a very low-fat diet for years, eating mostly egg whites when he consumed eggs at all. We made several dietary changes, including incorporating 2 whole eggs daily. 6 months later, his testosterone had risen to 485 ng/dL. Obviously, multiple factors contributed, but reintroducing dietary cholesterol and healthy fats from whole eggs was a key component. Effect 2. Muscle maintenance. As you age, maintaining muscle mass becomes increasingly critical and simultaneously more challenging. This age-related muscle loss, called sarcopenia, is associated with increased frailty, falls, metabolic dysfunction, and mortality risk. Eggs are one of the highest quality protein sources available. They have a biological value of 100, meaning your body can utilize essentially all the protein they provide. They contain all 9 essential amino acids in optimal ratios for human physiology. But here's what's especially important. Eggs are rich in leucine, a branched-chain amino acid that directly triggers muscle protein synthesis. Leucine functions as a metabolic signal to your muscles to build and repair tissue. Research published in the American Journal of Clinical Nutrition found that older adults who consumed adequate high-quality protein, including eggs, maintained significantly more muscle mass and strength compared to those with inadequate protein intake. And it's not merely about protein quantity. It's about the quality and complete amino acid profile that eggs uniquely provide. Biologically, eggs deliver optimal protein and amino acids for muscle maintenance and growth. Practically, this means you maintain strength, functional independence, and the physical capacity to continue activities you enjoy rather than progressively losing capability. Effect 3. Brain health. Here's something most men don't realize. Eggs are genuinely brain food, particularly important for cognitive health as you age. Eggs are the richest dietary source of choline, a nutrient absolutely essential for brain function. Choline serves as a precursor to acetylcholine, a neurotransmitter critical for memory formation, learning capacity, and overall cognitive function. Research demonstrates that adequate choline intake is associated with better cognitive performance across multiple domains, while deficiency is linked to cognitive decline and increased dementia risk. Eggs also provide omega-3 fatty acids, especially in pasture-raised eggs, that support brain structure and reduce neuroinflammation. B vitamins, B6, B12, folate, essential for neurotransmitter production and cognitive health. lutein, and zeaxanthin, antioxidants that accumulate in brain tissue and are associated with better cognitive function. A study published in the journal Nutrients found that higher egg consumption was associated with better cognitive performance in older adults, likely due to the combined effects of choline, B vitamins, and other brain-supporting nutrients working synergistically. Biologically, eggs provide nutrients essential for neurotransmitter production and brain structural integrity. Practically, this translates to better memory retention, improved focus, and sustained mental clarity as you age. Effect 4. Eye health. As men age, risk of age-related macular degeneration, AMD, and cataracts increases substantially. These conditions represent leading causes of vision loss and blindness in older adults. Egg yolks are rich in lutein and zeaxanthin, powerful antioxidants that specifically accumulate in the macula of your eye and protect against oxidative damage and blue light exposure. Research published in the Journal of Nutrition found that consuming eggs significantly increased blood levels of lutein and zeaxanthin, and these increases were associated with reduced risk of both AMD and cataracts. What's particularly remarkable, even though eggs don't contain as much total lutein and zeaxanthin as some vegetables, the bioavailability is substantially higher, meaning your body actually absorbs and utilizes more of these protective antioxidants from eggs than from plant sources. Biologically, eggs provide highly bioavailable antioxidants that directly protect retinal health. Practically, this means protecting your ability to read, drive, work, and fully engage with the visual world around you as you age. Effect 5. Cardiovascular health. This is where the science most dramatically contradicts old dietary myths. For decades, we were warned that eggs would clog arteries and cause heart disease. But modern research tells a completely different story. Multiple large-scale studies have found no association between moderate egg consumption, up to 1 daily, and increased cardiovascular disease risk in healthy individuals. A study in the British Medical Journal following over 500,000 people found no association between moderate egg intake and heart disease risk. Research in JAMA involving over 177,000 participants found similar results. A meta-analysis of prospective studies concluded that consuming up to 1 egg daily had no association with cardiovascular disease risk. But here's what's even more compelling. Eggs may actually support cardiovascular health through several mechanisms. They increase HDL cholesterol, the protective form, contain choline, which helps prevent homocysteine accumulation, a cardiovascular risk factor, provide antioxidants that combat oxidative stress and inflammation, and are nutrient-dense and satiating, supporting weight management. Now, there may be a small subset of people who are hyper-responders to dietary cholesterol and do experience significant LDL increases from eating eggs. If you're in this group, work with your physician to determine appropriate intake. But for the vast majority of people, eggs do not negatively affect cardiovascular health. Biologically, eggs provide nutrients that support heart health without increasing cardiovascular risk for most people. Practically, you can include this nutrient-dense food as part of a heart-healthy dietary pattern without fear or guilt. Effect 6. Weight management. If you're trying to lose weight or maintain healthy weight as you age, eggs can be a powerful dietary ally. Eggs are highly satiating. They keep you feeling satisfied significantly longer than most other breakfast options. Research demonstrates that eating eggs for breakfast leads to reduced total calorie intake throughout the day compared to consuming bagels or cereal with identical calorie content. A study in the International Journal of Obesity found that overweight individuals who ate eggs for breakfast lost significantly more weight and body fat compared to those who ate bagels, even when both breakfasts contained the same calories. Why? Several physiological mechanisms. High-quality protein increases satiety and preserves muscle during weight loss. Fat content slows gastric emptying, keeping you satisfied longer. The complete nutrient profile reduces cravings, and blood sugar stability prevents the dramatic spikes and crashes that trigger hunger and overeating. Maintaining healthy weight is crucial for testosterone levels, cardiovascular health, and overall male vitality. Biologically, eggs support satiety and healthy metabolism. Practically, this means you're not constantly battling hunger and cravings throughout the day. Effect 7. Prostate health. While research specifically on eggs and prostate health is somewhat limited and mixed, eggs provide several nutrients important for prostate function. Selenium, essential for prostate health and associated with reduced prostate cancer risk in some studies. Zinc, critical for prostate function. Vitamin D, where deficiency is associated with increased prostate cancer risk. Choline, which may play protective roles in cellular health. What's equally important is what eggs don't contain: processed ingredients, excess sugars, trans fats, and inflammatory compounds found in many breakfast foods that negatively affect overall health, including prostate health. The key with prostate health and diet is the overall dietary pattern, emphasizing whole foods, adequate nutrients, healthy fats, and avoiding heavily processed foods. Eggs fit perfectly into that evidence-based pattern. Effect 8. Nutritional value. Let's discuss the overall nutritional profile, because this is where eggs genuinely shine as a food. A single large egg provides 6 grams of complete, high-quality protein, 5 grams of healthy fats. Vitamin A, immune function, vision. Vitamin D, hormone production, bone health, immune function. Vitamin E, antioxidant protection. Vitamin K, bone health, cardiovascular function. B vitamins including B12, energy, cognitive function, nerve health. Folate, DNA synthesis, cellular health. Choline, brain health, liver function. Selenium, antioxidant function, thyroid health. Zinc, testosterone, immune function. Iron, energy, oxygen transport. All of this for only approximately 70 calories and less than 50 cents per egg in most locations. From a nutritional economic standpoint, nutrients per calorie and nutrients per dollar, eggs are among the most cost-effective whole foods available. Now that you understand what eggs can do for your body, let's discuss how to incorporate them effectively. Step 1. Aim for 1-2 eggs daily. For most men, consuming 1 to 2 eggs daily provides substantial nutritional benefits without concerns. This could be 2 eggs for breakfast with vegetables, 1 at breakfast and another in a lunch salad, hard-boiled eggs as snacks, or eggs incorporated into dinner. Step 2. Eat the whole egg. Don't discard the yolk. This is crucial. The yolk contains virtually all the vitamins, minerals, choline, healthy fats, and compounds that support testosterone and overall health. Egg white omelets might be lower in calories, but you're sacrificing the most valuable nutritional components. Step 3. Choose quality eggs when possible. While any eggs provide benefits, higher quality eggs offer additional advantages. Pasture-raised eggs have higher omega-3 content and better fatty acid profiles. Organic eggs reduce pesticide and antibiotic exposure, but don't let perfect be the enemy of good. Regular eggs are still highly nutritious. Step 4. Prepare them healthfully. How you cook eggs matters. Best methods include boiled, poached, scrambled with minimal fat, or baked. Avoid deep frying or cooking with excessive processed oils. Step 5. Pair with vegetables and whole foods. Eggs are versatile and pair beautifully with vegetables, which provide fiber, additional nutrients, and support overall health. Try scrambled eggs with spinach and tomatoes, veggie-packed omelets, or hard-boiled eggs with salad. Step 6. Monitor your individual response. If you have existing high cholesterol or cardiovascular disease, work with your doctor to monitor your response to regular egg consumption. Get baseline labs, incorporate eggs regularly, and recheck after a few months to assess your body's response. I want to speak directly to those of you who've been avoiding eggs for years because you were told they were unhealthy or dangerous. I understand it's confusing when nutritional guidance changes. For decades, eggs were demonized. You were advised to limit them severely, eat only whites, worry about cholesterol. But here's what you need to understand. Science evolves. We conduct better studies with larger populations and longer follow-up periods. And the modern evidence is remarkably clear. For the vast majority of men, eggs are not harmful. They're genuinely beneficial. You don't need to fear eating them. You don't need guilt about enjoying them. You don't need to discard yolks or limit yourself artificially. Eggs represent whole food nutrition at its best. Affordable, accessible, versatile, and packed with precisely the nutrients men need for healthy aging, hormone